Want to welcome you all in to Coronavirus Inside the Arizona Numbers. It is Friday, August 27th, 2021. Garrett and I here with you again on this Friday afternoon. We want to get to all your questions and help you navigate through some of the new data that's out there. Obviously, the big talker today, the big headline today is that we hit 1 million cases here in the state of Arizona since the start of the pandemic. We pretty much knew that was coming based on the number of 2,000 to 3,000 new cases that we'd get each day. Everybody always says, oh, who cares about cases? Well, cases then translate a percentage of that into hospital stays, and sadly, a follow-up percentage of Arizonans that we lose. So that is the big concern in all of this. So let's get to the numbers, as we always do, Garrett, and help people walk through some of this information. 1 million cases in today in Arizona.
1 million cases in today. So what that translates to, and my apologies while I'm not distracted, I'm trying to get this data out really quick so I can show you what this means for the rest of the country as far as where we are. So basically, when you look at the rest of the country and everyone else who was hit, so when you look, I took the census data. I'll start there. I took the 2020 census data that we have right now. And I took it to see like what other states have reached about where we are with 1 million. So obviously, when you're talking about 1 million cases in Arizona, that means something very different for Florida, California, just states that are much larger than us. But what is the same is the number of the percentage, if you will, of the numbers that they have on. Let's see. I'm sorry. I'm distracted as I'm doing this. As far as the percentage of the population is what I'm trying to say. So I'm pulling that up right now to show you where we are with other states and how long it's taken other states to get there. So.
Because Garrett, if I heard right,
yes.
we're only like the 13th state to hit 1 million. Obviously, some aren't going to hit 1 million. They're not
Correct.
so
There's
big,
just simply not enough people in those states to hit 1 million. And yes, we are we're about the 13th state to hit 1 million. That does put us in about 1 to 7. 1 in 7 Arizonans have been reported positive for COVID-19. And I say it that way because we have to remember that, when it comes to the COVID-19 cases, while this is a milestone with the data and with the numbers that are being reported, there's always going to be a higher number of people who have had COVID-19, especially in the younger demographics, people under a certain age, especially children, where a household got COVID-19 and didn't officially
maybe test the whole family.
Their kid. They didn't test their 6-year-old because everyone else got COVID. So why subject a 6-year-old for that? So this is one of those things where, as far as the data is concerned, these are positive tests, confirmed positives, and this is the day that we hit 1 million. So it's taken us 49 days to get from 900,000 to 1 million. While that sounds fast, the fastest Arizona has ever done that in was 13 days, when it went from 500 to 600,000 in 13 days, and that was back during the winter surge. So if you could just imagine the speed in which we're going right now compared to what we did during the winter surge, while 49 days is by no means slow, because we have other times when you break everything up into 100,000 increments. There are times when it took us longer than 150 days to get from a certain 100,000 value to the next one up. But this is nowhere near as fast as we were. So the surge right now we're seeing is very reflective of what we saw last summer. In fact, it's almost identical as far as the speed of growth, but nowhere near as fast as what we were in the winter right now.
Yeah, it puts that in perspective there. Some of the other numbers for comparison when we're drilling down to counties, and obviously talking about 1 million, we hit 1 million statewide. But when we drill down to Maricopa County, we're actually coming in second in the nation for confirmed COVID cases, when really, if we're the 4th largest county in the nation, appropriately, we should come in at the 4th spot. We're 2 ahead. Los Angeles first, then Maricopa, then Miami-Dade, then Cook County. So that order has fluctuated throughout the life of the pandemic, but we're taking second for confirmed cases and then 3rd for the number of deaths per county. So we're higher in both those categories than technically we should. I hate to use the word should, but then we should be based on population.
Yeah, well, when I look at the numbers based on the population, and this is using the brand new census data, we are the 10th highest state of the percentage of people that have COVID-19. The highest state being North Dakota. North Dakota, about 15% of North Dakota has tested and confirmed positive for COVID-19. Our number is 14 even. In fact, it's 14%. Just basically in the same place as Utah and just under where Florida is. So we're in the top 10 of states as far as the percentage of the population that has tested positive. As far as a million itself, let me just sort this by large to see.
And that's not surprising, Garrett. As you mentioned, North Dakota. I've talked about it on here before. I watch South Dakota and North Dakota very closely, just because it's my birthplace is there. My family all lives there. Pretty low vaccination numbers in North Dakota, so that's kind of reflective of what we're seeing in the cases now.
Really, I'm looking at the data right now as far as the cases and other states that have hit 1 million already. And really, the only state that we are of a higher population is Tennessee is the only other state, which is the state just above us that has already hit 1 million, and they have a slightly lower population and a slightly higher number of COVID-19 cases. But every other state is a state that you would expect to see already 1 million cases. I mean, California being on the top, even though they only have 10% of their population that have confirmed positive with COVID-19, their population's 39 million. So of course they're going to have 4.3 million, but it's going to be such a small number. Georgia has 10 million people and 1.3 million, 1.4 million COVID-19 cases. So some of these other states, they're just larger states. And I said Tennessee is the only state that looks like it is in a slightly worse situation than us, because they have a lower population with a higher number of COVID-19 cases.
If you guys have questions in the comments, I know everybody's just kind of fighting in the comments right now. I don't know if it's a full moon Friday or something going on, but people are kind of fighting in there. We'd love to answer your questions, though, and help you with the data. Remember, we know that people are watching from all over the world on this, but that we only focus on Arizona numbers. We can show you how we find the numbers in Arizona, and you can apply it to your home state as well. But we're happy to answer those questions. I mean, we're looking at 214 million confirmed cases globally and 4.4 million deaths, and just numbers that are almost mind-boggling, Garrett, because when we started with this and we were updating people every single day and we were watching these numbers grow, and now just week to week, it's pretty overwhelming when you're looking at those. The one note of hope that I want to talk about also this week, Pfizer went to full approval for 16 and older, and that happened Monday. So they were hoping that would encourage a lot of people to get vaccinated who were holdouts. They said that of the people they spoke to, 3 out of 10 unvaccinated said they were waiting on this very thing, and that would push them over the edge to go ahead and feel safer getting the vaccine. Are we seeing that reflected in the vaccination numbers in Arizona, or has Monday been too soon to see these numbers change, Garrett, or improve?
Yes, so I wanted to go over the actual AZDHS numbers, and then I'll segue into the vaccination numbers with that. So just because we haven't gone over those, so these numbers, of course, as we talked about, there's your million. We finally hit 1 million here. This death number, 63 deaths. These are all very recent, and I must say, this is a higher death number than we've seen in quite some time. I'm looking back right now to see when was the last time we had this many deaths reported, and I had to go back as far as March 11th. March 10th to find a number this large. So, this is quite a high number. And when I looked at it, it is also fairly recent. So we are seeing at least a higher number of reported deaths right now, and we are seeing this reflected in the hospitalization numbers. The ventilator ratio is very high right now. And so unfortunately, there's a lot of people out there that are very sick with COVID-19. Obviously, it's nowhere near what we were in the wintertime, but just, bear in mind that, that's a very high number as well, even though it's not, the million threshold, the case threshold.
Yeah. I just want to mention in some of the comments, Patty, I saw your comment there. She said she has just lost a friend yesterday. So we're very sorry for your loss. And I don't know if this friend was in Arizona, but we talk about the numbers here, but we never forget that behind all of these numbers are a family who very much loved and misses their friend or their relative. So I just want to pause to say, Patty, we're sorry for your loss.
So going to the, yes, absolutely. Sorry. Going to the vaccination data, we're going to take this and look at this. This is the administration. This is the total number of vaccinations administered. I wish I could make it a little larger, but what I will do is I'll turn it into a weekly graph here because it's a little easier to see.
Sure is.
Yes, and you can see right now, this is the first time this last week, August 15th, which is the last week we have complete data for vaccinations, is the first time we hit 100,000 vaccines since June 13th for that week. So we are seeing an increase. It's a small increase, but you can definitely see it's noticeable. The last several months, or excuse me, the last month or so, we've been at about 96,000 vaccines every week. We're now back above 100,000, and hopefully this appears to be on track to continue. That 60,000 will likely continue and get to above 100,000. So, we are seeing about 16,000 vaccines a day going out right now and being administered.
So when we see that lower number in that most recent week, just to remind everybody, it's not that this last week was so much lower. It's that that week's numbers haven't totally filled in just yet to match some of the others.
Yes, this is August 22nd, and really vaccinations, it takes about 3 to 4 days for the vaccinations to show up on this board. So for example, if someone got vaccinated today, we're not going to see this data until probably next Monday or Tuesday. So that's why it's just a reporting lag.
Yeah. Linda's asking about a decline in numbers when we're going to hopefully see some sort of decline in numbers. I believe she said she was watching from Missouri. So first of all, Linda, thanks for watching from Missouri. We'll go through Arizona's numbers, but I want to tell you, Linda, that there's a pull down bar on the top of this IMHE site that will give you Missouri as well. So if you're interested in Arizona numbers and both the numbers where you're watching from, you can find those there. The concern is, Garrett, from those projections is that this is going to hang on for a few more weeks in Arizona. And sadly, there's also projections of lives lost in there. And it looks like by December 1, which is how far out their projection currently goes, we're set to lose 3,000 more Arizonans to COVID.
Yeah, let's go to that IHME dashboard that you just referenced. Yes, you can see that if we look at the COVID-19 reported deaths and projected deaths, we have their projection and then what they think is the quote unquote worst case scenario. So let's focus on the current projection. You can see the current projection has us at approximately 21,700 deaths in and around December 1st, which, as you said, since we're at 18.7 right now, that's an additional 3,000 that we should see, sadly, by December 1st. As far as the number of daily deaths, I'm taking off this one because that projection doesn't matter anymore. You can see right now, as far as daily deaths, just because of the surge where it was, you can see it's expecting to see the surge go up to around 100 a day in early November is what this
That's so sad.
Yes, it is very sad.
I hated it last year when, at any point in the year to lose somebody is heartbreaking, but especially during the holidays. And when we've already gone through this once before, we know how very real it is. And talk to these families firsthand who have lost loved ones for the holidays. It's awful to see the timing of this again.
So you can see this is very interesting. I'm going to take worse off right now because, again, this is a worst case scenario, but this is the daily infections. And what's interesting about this is you can see the projections no longer believe we're going to be in a summit decline type situation. This is very different for a surge. They're thinking that our numbers are basically going to be slow and gradual and just continue all the way through the year. So we're just going to see increases. They're going to be very slow, but this is what it's expecting to see. All of our other COVID-19 surges have been very abrupt, usually lasting about 15 weeks, and then they just stopped and they just dropped like a rock. And what this projection is saying is that IHME believes that we're not going to see that from here on out. We're just going to see a slow burn, if you will, all the way up until December to where we're, getting, and this is infections, this is estimates. We go to confirmed infections. It's slightly different, of course, but this is, as you can see, we're talking about, this is thinking about 6,000 a day going up to 8,000 a day. Now, again, this is confirmed infections, not the numbers reported by the AZDHS. This number is always much higher than those.
Yeah. Jen is saying, don't worry about the number of cases. Look at the hospitalizations and the deaths. Those
Yes.
are low. We're all right. Jen, we just want to remind you that these come in 3 waves. So this is the infection and wave that we're seeing here. And then the hospitalization wave follows. And then the death wave follows. So it's a sort of 3 waves that we go through in this. So yes, although deaths aren't as high as they're projected to be in upcoming days, we're on our way there if we don't do something more.
I already know that many of the hospital systems have begun the process of stopping elective surgeries to make room for COVID-19 patients. You can see again this IHME number. It does believe that our projections are going to be more of a slow burn going up. Our hospitalizations are just going to increase slowly, and we are actually starting to see a little bit that in the data right now. It's very early in the hospitalization data, but we are indicating a slower number of hospitalizations, but it's something that should continue. Of course, I know one of the things that a lot of people like to say, and I understand, why they believe that, is that, as Linda was it, she said cases aren't. Jen, sorry,
Yeah.
Jen says cases aren't important, only hospitalizations and deaths. And there is a degree of truth to that, but the reason that we look at cases is not like some sort of case race, but because as cases increase, so will hospitalizations. Cases are the first indicator that things will continue. So on the flip side of that coin, when cases start to go down, that's also the first indicator that
Things are going to get
hospitalizations and
better.
deaths are going to go down. So that's one of the reasons why we still look at cases, not because we're trying to see how many people got infected with COVID-19, but obviously because those numbers, that case number will always sort of lead by 7 to 20 days everything else.
Yeah. And honestly, Garrett, that's why it's been kind of frustrating through some of these waves. What this is sort of Arizona's what, 1, 2,
This is our
fourth
third large. We have I count. We have a small wave back in September of last year when ASU and U of A opened, but it's very small.
Yeah.
But so really 3 major waves.
So I think you're going to echo the same sentiments, but it's so frustrating when you see the increase in infections, and sometimes it can feel like nobody's listening. And then when you get to the deaths, then everybody's saying, "Oh my gosh, there's so many deaths, we have to do something." We're already coming down the other side of that in most cases, unless it's a sustained peak that we're seeing up there, which we have seen a couple of times. But it's so late to the reaction. It's late to the masking or late to the changes to make things better, to encourage us to get out of this.
I mean, if we look at I'm going to take you to my internal dashboard, and that, just to show you what the epi curves look like right now. So, I'll try to explain some of these as we go through them. So, this is basically the percentage daily average case change. So this is basically a line that shows you if COVID-19 is growing or falling in Arizona. And you can see back here in June, you can see while it's in the negatives, that's why, COVID-19 was falling at the time. And then we had this massive surge right here in early July. And now you're starting to see it sort of, now it's saying, it's much slower, but it's also gradual. This still means it growing. If it's above this black line, then COVID-19 is still growing in Arizona, but the growth is much slower than it was, say, 3-4 weeks ago. And you can actually see that as well this is vaccination rates. We'll get there in a second. But we go over here, you can see the curve. And this is actually not reported. This is when people actually were tested positive. And you look at these curves, just basically look at all of these. So this is our first wave. You can see it hit this week, basically the 4th of July week, and then it dropped very quickly. This is the major winter surge. You can see this one went up very aggressively. And then here in late December, closer to Christmas, it sort of slowed down for a moment. And then it shot up again very aggressively to the point where there was 12,000 people in one day that actually tested positive for COVID-19. And then it dropped incredibly fast. And then we got to this lull point, and you see we've been sort of going on this increase since early July, but it sort of has a different character to the rest of these curves right now. It's much more gradual. The slope is smoother, and it already looks like it's bending. Now, that's the question. Does this bend down, and are we going to start seeing the cases go down? Because when we look at these other curves, we think, oh, the cases should start to go down. And that's the concern, is that maybe we are in a situation where it's more going to be a slow burn, and this peak is not going to shoot up to these numbers by any means, but it's going to stay in a more sustained pattern up here for a little bit before it starts falling down again.
Yeah. Some of these questions, Cecile is asking about the kids, and I do want to make sure that we make time for that as well. What numbers are showing up for kids, because they've gone back to school, and we of course promised everybody we would be checking on the under 20 group. I know everybody's going to ask. Let me preempt this by saying the under 20 group is how the state splits it. It's the information that we get. We wish we had numbers under 5, between 10 and 15. You know, breaking it down a lot more, but this is what we have. So under 20, is that group still increasing, and are we seeing a pop from ASU?
It's staying at about 33 to 34%. So they're about 1/3 of the cases coming in right now are from the under 20 group. This is a very high share, daily share for under 20, and they're the only other time aside from the last week that this group has been at this level is during that little ASU U of A surge, and that only lasted about 3 days. We're already a situation where it's been I believe 7 to 10 days now where the under 20 has been 1 of 3 tests, and I'm looking today's share for under 20 is 34%.
Wow.
Which and now, just to give you an idea, when you look at their total pandemic share for what they have for all cases, they're only 17%. So right now they're double what their sort of total proportion is, and we're seeing that not the opposite, but this is driven by the younger. So 20 to 44, 38% as opposed to 44%, which is their total proportion. 45 to 54, 12%. Their total proportion is supposed to be 14, so just about where it should be. But then when we get to the older populations, 65 plus, the most vulnerable population, they're 7.2% of shares right now, about 270 shares to 270 cases today. That total share is supposed to be about 13%. So the good thing is that people who are most vulnerable, as far as at least in their age category, they're making up less and less. And that's one of the reasons why when you look at the projections, they don't believe that our deaths are going to be as high as they were in the other surges.
Yeah. Speaking to that, I saw some questions about breakthrough cases coming up, and I want to get to some of those as well. Of all the breakthrough or all the cases that they're seeing in the hospital here, in fact, one of the hospital groups, I forget if it was Banner or Valleywise, they said that in their ICU, everybody in their ICU was unvaccinated. They didn't have one person in there who was vaccinated with COVID.
Yeah,
just announcing that
seen
this
that
week
too. Yeah, every almost all hospital systems are saying the same thing. Like, they do have other people in the hospital, but the ICUs are being made up of almost entirely in the 95 to 99 percentile are unvaccinated. Yes.
Yeah, showing the real life results of that. All right, some of the other numbers. I do want to get to a few more of the hospitalization numbers that come out from the state each day, and where folks can find that on the AZDHS site. I don't know if that's easiest, or one of your own graphs, Garrett, that
no, we'll go to AZDHS for that one. My graph isn't necessarily much better than theirs, so we'll
You're welcome, Jim. Thank you for the comment. Jim saying thanks.
So let's look at hospitalizations. So let me just pull up my reference sheet here as well. And then where we go on the AZDHS website, there's actually several places to go. I'm going to go to the one where it's easier to see for us, because some of these are just too hard to see. So we're gonna go here for now, which is the hospital COVID-19 specific metrics. It's basically showing what the hospitals are saying are in their specific. These are all self-reported numbers, by the way. This is something we've had to go over a long time. Like our little Angela Meadows in there saying lies, lies, lies. So they're not lies. These are self-reported numbers. And why that's important is when people are sort of in the conspiratorial mindset, they believe that there's some sort of unseen hand that's trying to either make more money for a hospital or make more money for somebody, and is manipulating the numbers. Well, if you have 300 different hospitals, not hospital systems, but 300 hospitals, all self-reporting this data into the AZDHS, then there's less chance for manipulation. And if one hospital is manipulating the numbers, it does not impact the whole. So that's one of the things to know about this particular data set. It's why it's probably the best hospitalization data set we have, because we just know that because it is self-reported by multiple hospitals, that you're going to get a much smoother line. So anyway, that being said, this is where we are with our hospitalizations right now. It is about, let's see, the increase for ICU is about 12% right now from last week. So we're at about, we're an inpatient right now. I'm sorry. This is a 10% increase. You can see this is a very, I mean, it's gradual. It's much more gradual than the rest of than these two, but it's constant. I mean, this is going up, and we're not seeing it, and we're not going to see any slow. We're not going to see this slow down that much until we start seeing cases slow down as well. But as you can see, we're at about almost 2,000 cases in the ICU, or excuse me, in the inpatient. Ventilators, you can see this one is actually going up a lot faster.
It's very high right now.
Yes, it is very high. It's about where it was, about 50% of or so where it was in the summer surge. And you can see, I mean, it's going up. And when COVID is not surging, this number is very, very low. When we look at the ICU, this is how we get we're at a bit of a peak at our ICU numbers right now. That doesn't mean this peak is going to stay. In fact, it should continue, but we're at about 500 or so. You can see 491 today. The discharge numbers, these are people who are either discharged from the hospital with COVID-19, or unfortunately, they died in the hospital, because those numbers are, that also counts as a discharge in medical definitions. And you can see fairly high, about a little higher than we were in the first surge right now with discharges, about 50% where we were in the winter time. We're also seeing similar higher numbers in the emergency room departments, not quite as high as at the full peak of both of these, but still quite high right now. And then intubations, this one is a little noisier, as you can see, and this one is about where it was at, is about 50% or so of both of these others.
All right. I just want to give a shout out to producer Josh, who is working feverishly through these some of these comments. Listen, we're not going to allow
very fun people
cuss words, and I can't even repeat the things that are being said in the comments. We're just not going to allow it. We're going to remove you from the thread, and you're going to have to rejoin a little bit later. So
yeah, and these
these
hospitalizations are COVID-19. I know some people love flu, but you know what? These hospitals need to separate COVID-19 patients from flu patients. So these are COVID-19 patients.
Yeah, they can. I just want to encourage anyone who's looking for the flu numbers. You can still look up flu numbers within the healthcare system and within AZDHS. There's still a section for flu, and at a point when that takes off and we need to do an update on that, we'll do that too. And I can show some. You can actually go back to our info before, and in fact, here's the link right here. If you want to peek at it, you can see all the numbers. You can see the really awful year that we've had. I believe it was like in 2014 or 15, you can see all those numbers. So it's all right there for you if you're looking for that. But we're strictly here in this conversation, staying with COVID and the response here in Arizona to that. Schools, everybody's been asking a lot about the schools. And I just want to remind everybody, you can find our very latest schools reporting. And that includes some of the outbreaks and some of the links to the public facing pages that let you know about COVID in your schools by going to abc15.com/schools. Most schools do have a public facing dashboard with active cases and recovered cases, and you can kind of search things out there. You should also ask your school district what their policy is for communicating with you. If there is someone sick at your child's school, will it just be within your pod, within the classroom, within the grade level, or within the whole school? So all of that information's there as well. Ingrid's writing, thanks for removing the nasty comments. They are useless and rude. Thank you, Ingrid. And just thanks to producer Josh. We've had a couple different producers help us to put this together. Carrie's been with us several days, and Josh is working through these, so we appreciate it.
Yeah, and I'm gonna read it. Yeah, and I'm gonna address something really quick before I go on to schools, because someone said tests are unreliable. So let me show you what this testing looks like, the laboratory testing, and show you why that is not the case. So when you say the word unreliable, obviously unreliable suggests that there is a percentage of these tests are going to come back incorrect, or the data is going to be quite noisy, is what unreliable is. But as you can see, when you look at the testing data, and let me move to diagnostic testing, so we take the serology out, you can see sort of correlations all over the board here. I mean, this curve correlates with our current curve in cases as well, as does these percent positives. There's not a lot of noise in these numbers. Even when I move it to the daily testing, you can see that this number, as far as reliability, this would be the most important number. If these tests were unreliable, then this would be jumping all over the place. As is this, as you can see, the serology test is jumping all over the place. The PCR test, which is the actual diagnostic test, does not jump all over the place. It is very consistent with the curve and where things are going. So I know people believe that these are unreliable tests, but statistically, they are not unreliable.
Yeah, the most unreliable part is user error when you're doing an at-home test where you're not administering it properly. Not that there's specifically something wrong with the test. Denise is asking about booster shots and her third shot. Denise, right now it depends on which shot you got. They want you to stick kind of with the same brand at this point. So if you've had Pfizer, they all they're ready for your third booster shot, and they also just got full approval. Also, Moderna is requesting priority review, and Johnson & Johnson is talking about boosters at 6 months. So here's the deal. We talked about this a couple of weeks ago. There is a study that is yet to be peer reviewed, so it's early on, but it's saying that they're losing efficacy of about 9% every 2 months. So that's when we would get closer and closer to needing that booster shot. That's why some people, some companies are saying we'd like to see that at 6 months. Other people saying 8 months. They were hoping to stretch it a year. We'll see how it all shakes out in the end. We're learning a lot from Canada too. They did their shots a little differently than we did. They're having better results with them holding off the disease. So we're kind of looking at what they did too. We've taken a note from a few other countries. Israel's been one. If you want to watch what Israel's doing, weeks later or days later, you're seeing some of the same things happen here. I said that they were getting booster shots, just watch. And then we started to get booster shots here. So Denise, to answer your question, September 20th is the day when those are going to start rolling out. You might want to talk to your doctor first, of course, before working through anything. We always highly encourage that. But especially if you have anything else going on, they're going to want to know a little bit more about it. But you can head over there for your third shot.
Yeah, I mean, obviously, if we're looking at an 8-month window, there's still very few people in Arizona that would qualify for a booster in an 8-month window right now.
Yeah. Okay, let's see. Any test to find out if your vaccine is starting to wane? I haven't heard of that yet, Kimberly. I don't know.
No, I mean, you can test your antibodies. You could do a serology test, which is a blood test to test your antibodies. But even that is probably, as we just looked,
price prohibitive because they still charge you for that.
You do get charged for that. And as I just showed you, it's much less reliable than the PCR test. So, you know, you can do it. You know, you could show something. I have talked to doctors who said that the problem with these sorts of tests is that, you know, we don't really understand how our antibodies truly work as far as how they are generated. And while, you know, we could at one point show very weak antibodies in our blood, if introduced to a disease, we could really just flare up and get those antibodies immediately. So, you know, there's a little more to it that our bodies aren't really telling us as far as antibodies are concerned. So.
Yeah, and I'm seeing in the comments the difference between 12 to 16-year-olds and 16 and up. So Pfizer got full approval for 16 and up. It is still on emergency use authorization for 12 to 15. Yeah. So just to note that in there for those of you who are following the technicalities of the approvals. All right, let's see here. We still have a little more time. I was seeing if we're running out of time here. A lot of people are talking about the new plan through Delta. Delta Airlines is saying, you know what, it's okay if you don't get the vaccine, but we are going to add a surcharge onto your healthcare plan here at Delta Airlines starting November 1st. So they're adding, it's pretty hefty too, Garrett. It's $200 a month, $400 a year for those who are bowing out of that. I know a lot of people on my Facebook page, I heard from both sides talking about this, but they weren't offering up any other solution if they didn't like it. You know, they didn't like when an airline fully mandated it. They didn't like it when the company said, okay, well then you pay for it. If you're going to the hospital, you pay the surcharge. So I don't know, you know, I'd be interested in the comments what you all think about it, but But
just don't swear.
Yeah. There's
Come on, people.
There's really just no winning though. If you're constantly saying like, I don't want that. It's kind of like what we're seeing with the vaccines. Like, I don't want to take the vaccine. I don't want to wear a mask. I don't want to. Then what are you willing to do? Like, you don't want to go on lockdown. You don't want to wear a mask. You don't want to get a vaccine. Like, at what point, what are you going to do to help solve this problem that we're in?
What you're going to do is get COVID-19, because this thing is as transmissible as the chicken pox. And so you just understand that, like, you're getting it. I mean, we're talking chicken pox here now, guys. We're not talking, we're not talking something else. It's one of the most transmissible, communicable diseases we've seen ever. You know, that's just the way it is. I mean, I don't know what else to tell you.
Yeah. I'm loving some of the comments coming in. Thank you. And producer Josh just put the question there, so we'd love to hear more of it. Lori's writing, there are insurance policies that have surcharges for smokers. Absolutely, they do. So this would not be something totally brand new. Kimberly writes, I'm pro-vaccine, but worry about mandating masks. Oh, it just left the screen. There we go. Mandating vaccines only divides us further. So this got a lot of people talking on my Facebook page. Super, super interesting. Let's see, Garrett, any other numbers that we didn't get to? We just have a matter of minutes left.
Yeah, we can go to just take a quick look at Maricopa County and the zip codes. It's not really exciting. It looks about the same what it always does, and just give a quick look there.
Yeah, for sure.
So let's just take a quick look. Here we go.
As you're pulling it up, we were also mentioning September 27th is the new deadline for all service members to be vaccinated, all U.S. service members to be vaccinated by September 27th as well. That involves 1 million people getting vaccinated right there.
Yes, absolutely. So
wow, somebody's in the orange.
It's Sun Valley or Sun City. Sun City.
Wow.
Sun City's in the orange. So good, always good, because as we said, 65 and up in this state are 90% vaccinated. This is a good thing. This is a very good thing that 65 plus 90% of them are vaccinated, because these are obviously the most at risk of COVID-19 just by age alone. And they're also the ones that, had been going to the hospital. Now we're seeing more younger individuals going to the hospital. So this is a good thing to see. We also see Fountain Hills has oh no, that's Fort McDowell. I was like, wow, that's really low. But again, Fort McDowell is a, that's tribal land. Sometimes they do their tests through other places. So I can see that numbers being 0, but there's not much here as far as exciting is concerned. All of these are in the red. This is the unified school districts. Queen Creek is typically the worst. You can see it's gotten a little better. 541 last week, 511 this week. Let's go to another one that's been sort of bad. Peoria, 357 to 332. So it's getting a little worse. Not Cave Creek. Nobody lives in Cave Creek. I'm just kidding. Carefree. Let's go to Scottsdale.
They're going to come to you in the comments. I'm just
kidding. Cave Creek, Carefree. I grew up in a place like that. 273 to 236 in Scottsdale. And then this area, oh, wow. Saddle Mountain, 976. That's pretty high. 478 to 976 in, now these are per capita numbers, by the way. This is cases per 100,000 new cases. So 976 in the Tonopah area right now. When we look at high school districts, you can see they're more closer to downtown and little, in most cases, a little smaller. Buckeye, 400, 436 going down. Phoenix Union, 308 to 307, about the same. And then let's go to Tempe, just to show Tempe, 279 to 288, a little lower. And then the zip codes, going back to the zip codes. Again, it's going to be Queen Creek. That's going to be the highest or close to the highest, but it is getting a little lower, 490 to 403. And then we have some other places, 444, 371 to 444, obviously growing up in Peoria. A lot of the suburbs right now are higher than the downtown areas. Like, for example, 85301. This is one that we used to concentrate on a lot because it was always one of the highest. But you can see it's not right now. It's about 294. It's actually going down from 321 to 294. Here's another one that's always high. This one right here, 85009, from 295 to 345 going up. But again, our biggest numbers right now are in Queen Creek, right over here in this area. These two right here, as well as another one that is in Pinal County, so you can't see it. But those are the highest numbers right now.
All right. Thank you for that, Garrett. And it looks like we're kind of running out of time here. We still have 101,000 Americans in the hospital right now. I mean, these are just wild numbers for COVID-19. So it's obviously something that we're watching all across the country, something that we will be continuing to track. Why are you giggling?
Because the person's saying there's no other kind of place. Lorenzo saying there's no other kind of place like Carefree. I'm like, no, there is. I promise. I lived in a place I grew up in a place in California very similar to Carefree.
So funny. I love it. I told you they'd find you in the comments. We love Lorenzo, by the way. Thanks for always joining us on here. His name's always popping up on here. So I appreciate that, that you're spending time with us on a Friday afternoon. Jackie writes, thank you for all the information. Jackie, thanks for joining us again. Let's see. In the meantime, want to let you know where to find us. As always, we'll plan to be back with you here next Friday. Garrett's Twitter account is Garrett_Archer. Easy for me to say today until it's Friday. My Twitter account @Katie Rammel. You can also find me on Facebook if that's the easiest place to stay caught up on some of this information. It's facebook.com/news from Katie. And our very latest coronavirus reporting can be found at abc15.com/coronavirus. And our newscast coming up at 4, 5, 6, 10. We also have a newscast over on the CW at 9 p.m. each day. Kristen's writing, thank you. I've got to get my son from school. Get over there, girl. I know. We have our family on pickup right now, which is why I'm able to meet up with you just at this exact time, because they walk in right at 3 o'clock. So that's why we always got to get wrapped up before my crazy littles come in and they're ready to rip their mask off because they've been in the classroom all day wearing their masks. So, all right. #Carefree is going to show up on Garrett's Twitter, Alex says. So let's get ready for it. All right. Let's see. Jolene, thank you. And Paige, thank you too. I'm glad you guys got some good information. If there's any questions we didn't get answered, let us know and send us a message, and then we'll try to include it in next week's broadcast when we catch up with you here. In the meantime, please be safe, everyone. Have a safe and happy weekend.